Hello and good afternoon to all of you. On behalf of the NephroPlus team, I'd like to welcome all of you to this webinar. It's a very important topic और आज हमारे साथ एक बहुत ही जाने माने और मशहूर और एक्सपीरियंस नेफ्रोलॉजिस्ट है डॉक्टर श्रीनिवास अंबिके। डॉक्टर श्रीनिवास अंबिके जो है सीनियर नेफ्रोलॉजिस्ट है नेफ्रोप्लस पुणे के सेंटर के देखरेख में उनके चलता है। और Dr. Srinivas Ambike is also a senior nephrologist and a transplant physician at Jahangir Hospital in Pune. He comes with an extensive 32 years of experience और एक बहुत ही impressive track record रहा है उनका। 600 से ज़्यादा सक्सेसफुल किडनी ट्रांसप्लांट्स किए हैं डॉक्टर अंबिके ने। तो with that brief introduction, I'd like to welcome Dr. Ambike to this webinar and thank you so much, डॉक्टर। आपने संडे को टाइम निकालकर हम सब पेशेंट्स के डाउट्स इस बहुत ही इम्पोर्टेंट टॉपिक को लेकर रिजॉल्व करने के लिए आपने ज्वाइन किया है। थैंक यू सो मच डॉक्टर अंबिके।
Thank you, Mr. Kamal Shah. Thank you for the nice and kind words. And I thank NephroPlus team and Kamal, you in person, for having invited me to share my views on this important topic, as you rightly said. So, to start the ball rolling, यानी शुरुआत टॉपिक की शुरू करने के लिए, I would probably start off with some of the basic functions that the kidney does when they are प्रॉपरली फंक्शनिंग इन आवर बॉडी। जैसे आपको मालूम होगा, ये दो बीन शेप्ड स्ट्रक्चर्स है अपने फिस्ट के साइज के बराबर, जो पिछले हिस्से में रहते हैं, और उनका महत्व हमको तभी मालूम पड़ता है जब वो काम कम करना लग जाते हैं। तो बेसिक फंक्शन, एज ऑल ऑफ अस नो, दे आर द मेन एक्सक्रीटरी ऑर्गन्स ऑफ आवर बॉडी। अपने शरीर में जो मेटाबॉलिक प्रोसेसेस होते रहते हैं हमेशा, वो अपने यूरिन के जरिए वो अपने शरीर के बाहर फेंकते हैं। तो ये तो उनका बेसिक फंक्शन जो आम आदमी को या ले पर्सन को भी मालूम रहता है। इसके अलावा एक दो फंक्शंस जो हमको जानना जरूरी है, एक जिसको हम एंडोक्राइन फंक्शन बोलते हैं, यानी किडनी एज एन एंडोक्राइन ऑर्गन। सो ये काफी लोगों को मालूम नहीं होगा शायद कि हमारे किडनीज में से दो या तीन किस्म के हॉर्मोन्स निकलते हैं। जैसे आपको सबको मालूम होगा कि पैनक्रियाज हमारे किडनी पैनक्रियाज इंसुलिन सिक्रीट करता है, जिससे ब्लड शुगर्स कंट्रोल में रहते हैं। वैसे ही एक इम्पॉर्टेंट हार्मोन जिसे हम एरिथ्रोपोइटिन कहते हैं, जो हमारे शरीर में हीमोग्लोबिन बनाने के लिए जरूरी रहता है। उसके साथ ही एक विटामिन डी का एक मेटाबॉलिज्म में किडनी का एक अहम रोल है। जो मोस्ट एक्टिव फॉर्म ऑफ विटामिन डी 3 है, वो भी हाइड्रोक्सिलेशन किडनी में ही होता है। और एक रेनिन एंजियोटेंसिन सिस्टम है, जो हमारे शरीर में ब्लड प्रेशर मेंटेन रहने के लिए वो उसका काम आता है। तो बेसिकली जब किडनी का फंक्शन कम होते जाता है, जिसको हम हमारे साइंटिफिक टर्म में क्रॉनिक किडनी डिजीज बोलते हैं, तो अपार्ट फ्रॉम द एक्सक्रीटरी फंक्शन विच द किडनी लूजेस, इट स्टार्ट्स लूजिंग इट्स हार्मोनल और द एंडोक्राइन फंक्शन एज वेल। सो ये इसीलिए आपके नेफ्रोलॉजिस्ट आपको एडवाइस करते होंगे कि आपका हीमोग्लोबिन चेक करें, कैल्शियम फास्फोरस चेक करते रहें। और ब्लड प्रेशर तो ऑब्वियसली ये किडनी से ही निगड़ित है। द सेंट्रल ऑर्गन फॉर मेंटेनिंग द ब्लड प्रेशर इज द किडनी। तो बेसिकली हमारी किडनीज क्या करती हैं, सोडियम और वाटर बैलेंस, जो आज का जो टॉपिक है फ्लूइड ओवरलोड, कमिंग टू द टॉपिक पर से, जस्ट टू इंट्रोड्यूस, ये मैंने आपको बाकी के फंक्शंस बताए। तो कमिंग टू द टॉपिक ऑफ द डिस्कशन टुडे, फ्लूइड ओवरलोड जो है, यानी जो शरीर में एक्सेस वाटर इकट्ठा होता है, उसको हम हमारे टर्म्स में फ्लूइड ओवरलोड कहते हैं। जैसे अभी किडनी स्टेजेस, सीकेडी स्टेजेस में डिवाइड किए जाते हैं। जैसे किडनी का फंक्शन कम होते जाता है, वैसे ही ये एक्सक्रीटरी फंक्शन जो है किडनी का, वो कम कम होते जाता है। तो हमारे किडनीज का फंक्शन जब 30% या उससे कम हो जाए, तब जो नॉर्मल एक्सक्रीटरी फंक्शंस जो है वो इतने कम हो जाते हैं कि उससे अपने शरीर को कुछ ना कुछ इल इफेक्ट्स या साइड इफेक्ट्स या उसके जो दुष्परिणाम जो बोलते हैं, वो दिखने में आने लग जाते हैं। उसी टाइम पे ब्लड प्रेशर अगर पेशेंट को नहीं होगा, तो ब्लड प्रेशर बढ़ने लग जाता है, पाँव में सूजन आने लग जाती है, सॉरी। और जैसे किडनी का स्टेज और बढ़ते जाता है, या किडनी डिजीज एडवांस स्टेज में जाने लग जाती है, तो पेशेंट को चलना फिरना और सांस लेना ये सब मुश्किल होने लग जाता है। तो बेसिकली फ्लूइड ओवरलोड जो होता है वो किडनीज हमारे शरीर से जितनी मात्रा में वाटर या जितनी मात्रा में फ्लूइड्स एक्सक्रीट करना जरूरी है वो नहीं कर पाती हैं अपार्ट फ्रॉम द वेस्ट प्रोडक्ट्स, और वो शरीर में अपने पानी इकट्ठा होने लग जाता है। तो इसीलिए जरूरी ये रहता है कि आपका यूरिन आउटपुट कितना है, आप यूरिन अगर मेजर कर सकते हैं तो उस हिसाब से आपको आपके फिजिशियन, आपके नेफ्रोलॉजिस्ट एडवाइस करते होंगे, तो उस हिसाब से आपको इनटेक लेना जरूरी रहता है। क्योंकि किडनी का जो फंक्शन है, किडनीज कैनॉट एक्सक्रीट अ डिफाइंड वॉल्यूम ऑफ लिक्विड, यानी दे हैव अ फिक्स्ड कैपेसिटी टू थ्रो आउट वाटर एंड थ्रो आउट द वेस्ट प्रोडक्ट। सो इससे ज्यादा अगर आप पानी का श्रवण करते हैं, पानी का सेवन करते हैं, तो वो आपके शरीर में इकट्ठा होने लग जाता है। ये ज्यादा कब इम्पोर्टेंट होता है, जब किसी को किडनी फंक्शन, जिसको हम सीकेडी स्टेज 5 या एंड स्टेज रीनल डिजीज बोलते हैं, उन पेशेंट्स में ज्यादातर ये और तकलीफदायक होता है, क्योंकि किडनी का फंक्शन इस स्टेज में 5 या 10% ही रहता है। लेस देन 5 to 10% ऑफ द किडनी फंक्शन इज लेफ्ट, एंड दैट इज द टाइम व्हेन वी एडवाइज renal replacement therapy, in either in the form of a transplant if there is a suitable donor, or dialysis. And patient especially who are on dialysis need to be very particular about their fluid intake, क्योंकि डायलिसिस तो हम रोज नहीं करते। नॉर्मली किडनी तो हमारी राउंड द क्लॉक 24/7 काम करते रहती है, लेकिन एट द मोस्ट डायलिसिस, मोस्ट ऑफ आवर पेशेंट्स, 90 to 95% of our patients would be on say 2 or at the most 3 times a week dialysis and 4 to 4.5 hours session। तो इस दौरान जो अपने शरीर में वाटर इकट्ठा हुआ होता है, वो पेशेंट का अलोंग विद द वेस्ट प्रोडक्ट्स मशीन के जरिए निकाला जाता है। बेसिकली उसीलिए अगर पेशेंट का यूरिन आउटपुट कम होते जाता है, तो यूरिन मीनिंग वाटर का इंटेक रिस्ट्रिक्ट करना जरूरी रहता है। इस यहाँ पर एक मैं कंसेप्ट आपको इंट्रोड्यूस करूंगा जो आपको मालूम ही होगा। वी ऑलवेज टॉक टू आवर पेशेंट्स अबाउट अ ड्राई वेट। सो व्हाट डू वी मीन बाय अ ड्राई वेट? ड्राई वेट यानी ऐसा वजन जो पेशेंट जिस पर पेशेंट को ना तो पाँव में सूजन है, ना तो सांस फूल रही है, और कहीं पर भी फ्लूइड ओवरलोड यानी एक्सेसिव फ्लूइड अक्यूमुलेशन का कोई ये नहीं है, इंडिकेशन या कोई साइंस एंड सिम्टम्स नहीं है। तो ये हर एक पेशेंट हु इज ऑन डायलिसिस नीड्स टू अंडरस्टैंड व्हाट हिज और हर ओन ड्राई वेट इज। और ये जितना ड्राई पानी कम आपके 2 सेशंस के दरमियान इकट्ठा हो, उतना आपके लिए अच्छा रहता है। So that was the basic, or that was sort of some amount of an introduction about what we mean by fluid overload, how the kidneys take part in throwing out the excess water, and why patients with advanced kidney disease, advanced kidney failure, they need to restrict their water intake, basically because the kidneys have a fixed capacity or a limited capacity, I would say, to throw out the वाटर। जैसे मान लीजिए नॉर्मल आदमी अगर 5 लीटर पानी पीता है, तो 4 साढ़े 4 लीटर उसके यूरिन के जरिए एक्सेस वाटर निकल जाता है। यही अगर किडनी का पेशेंट स्टेज 3 या स्टेज 4 जो हम बोलते हैं, जैसे किडनी का फंक्शन मान लीजिए 20 या 25% से कम हो गया है, तो वो तो 5 लीटर यूरिन फॉर्म ही नहीं कर पाएगा। तो एवरी डे अगर मान लीजिए सच काइंड ऑफ अ पर्सन कंज्यूम्स अबाउट 4 to 5 लीटर्स, तो दिन भर में एवरी डे 1 या 2 किलो से पानी उसके शरीर में, या 1 या 2 किलो से उसका वजन बढ़ते जाएगा। तो दिस इज द कंसेप्ट विच ऑल ऑफ अस शुड नीड टू नो अबाउट व्हाट अ ड्राई वेट इज।
राइट डॉक्टर, बहुत बहुत धन्यवाद। इस डिटेल में आपने इस विषय को हम सबको समझाया। एक डाउट जो बहुत सारे पेशेंट्स को होता है डॉक्टर साहब, कि व्हाट इज द अमाउंट ऑफ वाटर दैट वी कैन ड्रिंक इन वन डे? ऐसा कुछ रिस्ट्रिक्शन, मतलब क्या, व्हाट इज द मैक्सिमम अमाउंट ऑफ वाटर दैट वी कैन हैव?
नहीं, जैसे मैंने आपको मीनिंग जैसे मैंने इंट्रोडक्शन में ही बताया, अभी मेटाबॉलिज्म के लिए या इंसेंसिबल लॉसेस जो हम स्वेटिंग से या पर्सपिरेशन से या थ्रू द रेस्पिरेशन ब्रीदिंग से होता है, दैट इज अबाउट 500 to 700 ml ऑफ वाटर इन 24 hours। ऑफ कोर्स दैट विल डिपेंड अपॉन द एम्बिएंट टेम्परेचर। ठंडियों में तो ये और भी कम हो जाएगा, लेकिन गर्मियों के सीजन में और इंडिया में आमतौर पर नॉर्मली गर्मी रहती है, तो 5 to 700 ml इनसेंसिबल लॉसेस रहते हैं। इसके अलावा जो यूरिन हर एक पेशेंट की रहती है, उसके ऊपर उसका वाटर इनटेक कितना रखना है वो निर्भर होता है। अभी हर एक पेशेंट विल नॉट बिहेव इन द सेम मैनर। कई सारे पेशेंट्स रहते हैं कि टिल द एंड, टिल द एंड उनका यूरिन आउटपुट मेंटेन रहता है। दैट इज व्हाट वी कॉल एज नॉन ओलिगोरिक chronic kidney disease. उनमें द पेशेंट्स कैन बी अ बिट लिबरल about taking their water intake. So, as a thumb of rule, we say about 500 ml of excess, 500 ml plus whatever the urine output of the individual is. This is, and for patients who are on dialysis, I would probably try to repeat whatever I just said. We need to know what the dry weight of the patient is. And if someone is taking, say, 3 times a week dialysis, तो द इंटर डायलिसिस वेट गेन, यानी जो आप डायलिसिस के बाद में जो वेट रहता है आपका, और नेक्स्ट सेशन में आप डायलिसिस से पहले जो वेट करते हैं, वो 1 to 1.5 किलो से अगर ज्यादा नहीं होगा तो आपकी बॉडी डायलिसिस अच्छी तरह से टॉलरेट कर देगी। यानी मान लीजिए आपका ड्राई वेट आफ्टर अ पर्टिकुलर सेशन इज से अराउंड 60 kgs, सो by the time that you come for the next session of your dialysis, it should not increase beyond 61 to 61.5, क्योंकि one would slightly technical thing which I would probably mention over here is, we say what is called as the blood volume. So for an average 60 kg man, the blood volume is around 5 to 4.5 to 5 liters of blood that we have. And whenever we are coming for dialysis, we are trying to remove out the water from this given 5 liters of urine, 5 liters of blood. So if you can target a ultrafiltration of 1 to 1.5 liters, your body can take it. बिकॉज जो पानी जो इकट्ठा होता है वो ब्लड में जैसे इकट्ठा होता है, वैसे ही अपने बॉडी स्पेसेस में, जिसे हम थर्ड स्पेस बोलते हैं, उसमें इकट्ठा हुआ होता है। और वो थर्ड स्पेस में से ब्लड में आने के लिए इट डजेंट हैपन सडनली। सो 1.5 kgs अगर आपका वजन बढ़ता है तो दैट कैन बी टॉलरेटेड, एंड ऑफ द 5 liters of a total blood volume that some individual is having, we are removing 1.5 liters. Of course, that gets filled up from the water that has, or whatever water is in lay terms, we would probably say fluid that is there in the third space. So about 1.5 liters of water is what the body tolerates well. Of course, we have patients who have ultrafiltration rates of more than 2 liters, 2.5 liters, but then they don't tolerate their uh, dialysis well. So as you rightly asked, Kamal, the intake of fluid, coming back to what your question was, should be according to what the individual output is.
Right,
And
right,
you, at every point of time, the patient should probably try to keep as close to as what the dry weight is.
right. तो डॉक्टर साहब, हमारे व्यूअर्स में से एक क्वेश्चन आया है। तो राहुल जी पूछ रहे हैं, सर मैं पिछले 7 साल से डायलिसिस का पेशेंट हूँ। मेरा सवाल है, प्यास लगती बहुत है, मैं पानी पीता भी बहुत हूँ। हर ऑल्टरनेटिव डे मार्च और अक्टूबर के बीच में 3 से 4 लीटर पानी पीता हूँ, और नवंबर से फरवरी 2 से 3 लीटर। मैं डायलिसिस के वक्त पैर में क्रैम्प्स आए तो भी पानी निकलना बंद नहीं करता, क्या ये सही है? और
सॉरी,
दूसरा,
क्या क्वेश्चन है? क्रैम्प्स आए तो
so
भी
basically he's saying कि he puts on almost 2 to 3 liters
थ्री
in
फोर
winter
केजीज
and 3 to 4 kgs in summer, और डायलिसिस के दौरान क्रैम्प्स आए तो भी अल्ट्राफिल्ट्रेशन बंद नहीं कर रहे हैं राहुल जी।
नहीं
तो
तो
इज इट ओके टू नॉट स्विच ऑफ अल्ट्राफिल्ट्रेशन इवन इफ दे गेट क्रैम्प्स, इज द क्वेश्चन।
no, see the cramps, that is what I said. That is the reason why I introduced that concept of third space. See,
करेक्ट,
the even if you have say put on 3 or 4 kgs, all that fluid, आप मान लीजिए जैसे आपने कहा समर मंथ्स में आप 3 या 4 लीटर राहुल जी पानी पीते हैं, बराबर? तो
राइट,
3 या 4 लीटर पानी पिएंगे तो 3 किलो तो कम से कम आपका दो डायलिसिस के दरमियान वजन बढ़ेगा। और
राइट,
ये 3 लीटर जो पानी आपके शरीर में एक दिन में इकट्ठा हुआ है, 2 दिन बाद डायलिसिस करते हैं तो वो या 5 या 6 लीटर तक बढ़ेगा, गोइंग बाय मैथमेटिक्स। तो ये
करेक्ट।
पूरे 6 लीटर तो पानी आपके शरीर में, पूरे शरीर में भरा हुआ है, वो तो सिर्फ पानी आपके ब्लड में नहीं है। और हम जो मशीन जो पानी निकालता है, वो ब्लड में जितना पानी रहता है या ब्लड में से जो फ्लूइड निकलता है वो ही निकलता है। आपके बॉडी में पॉजिटिव बैलेंस रहते हुए भी आपको क्रैम्प्स आते हैं, क्योंकि वो जो शिफ्ट जो बोलते हैं हम, फ्रॉम द थर्ड स्पेस, यानी आपके मसल्स में है, आपके टिश्यूज में है, आपके ऑर्गन्स में जो पानी है, वो तो तुरंत यहाँ से हमने पानी बाहर निकाला और आपके मसल्स का पानी, आपके टिश्यूज का पानी ब्लड में आ गया, ऐसे तो होता नहीं है। उसीलिए अगर मान लीजिए आप पॉजिटिव बैलेंस में हैं, फिर भी आपको क्रैम्प्स आते हैं, इसका मतलब आपका पानी इंटेक कम करना है। क्रैम्प्स अगर, क्योंकि जितना पानी आपके ब्लड में था उतना निकाल के बाद ही क्रैम्प्स आने लग जाते हैं, आपका ब्लड प्रेशर ड्रॉप होने लग जाता है। और एंड एज आई सेड, इट टेक्स टाइम फॉर द क्या बोलते हैं उसको, द इंटर स्पेस बैलेंस, फ्रॉम ट्रांसफर ऑफ फ्लूइड फ्रॉम वन कंपार्टमेंट टू द अदर कंपार्टमेंट। आपके ब्लड कंपार्टमेंट में जितना पानी है उतना निकालने के बाद में आपको क्रैम्प्स आने लग जाते हैं। लेकिन आप, ये मतलब नहीं हुआ कि आप ड्राई वेट पे आ गए हैं। इसीलिए द बेस्ट थिंग इज टू ट्राई एंड कंट्रोल द weight gain in between two dialysis. I
राइट।
hope that probably clarifies his point.
यस यस इट डज। डॉक्टर साहब, और एक आई थिंक बहुत ही इम्पोर्टेंट क्वेश्चन जो हम सब पेशेंट्स को है वो है कि आप बोल रहे हो कि 2 सेशंस के बीच में 1 से 1.5 या मैक्सिमम 2 kg
Kilo,
बढ़ना चाहिए, लेकिन
that's right.
हमें बहुत ही प्यास लगती है, ये प्यास को हम कंट्रोल नहीं कर पाते, जिसकी वजह से हम पानी मतलब ज़्यादा से ज़्यादा पीने का मन करता है और गला भी एकदम सूख जाता है। तो एनी टिप्स, कोई सुझाव ऐसे हैं आपके कि हाउ डू वी रिड्यूस और कंट्रोल दिस थर्स्ट दैट इज अ मेजर प्रॉब्लम फॉर ऑल ऑफ अस एक्चुअली?
You can replace plain water by, say, curd, thick buttermilk. These liquids, they are not 100% water. But I agree, controlling thirst, especially when the temperatures are high, they become difficult. So there are a few lozenges जो हम suck करने के लिए बोलते हैं, but I doubt whether they actually help. So basically, you will have to probably train your mind that because ये जो thirst जो है, it is more of subjective, obviously. So and replace your plain water with either the cold lassi, if ice creams are permitted, if you're not a diabetic. So you replace it with other thirst quenching items or liquids like that.
ओके ओके। राहुल जी का एक और प्रश्न है डॉक्टर साहब कि ही वांट्स टू नो कि उनका बीपी जो है डायलिसिस के वक्त अगर 200 के करीब रहता है, तो वो ड्रॉप करके अगर 150 से ऊपर रहे तो कोई प्रॉब्लम नहीं होता, लेकिन 140 से अगर नीचे चला जाता है तो उनको बहुत ही गर्मी और पसीने वगैरह होने लगता है, बहुत ही अनईजीनेस होने लगता है। तो उसका क्या उपाय हो सकता है डॉक्टर साहब? हेलो। लगता है डॉक्टर साहब का इंटरनेट का थोड़ा प्रॉब्लम है। वी जस्ट फिक्स इट इन अ मिनट। हाँ डॉक्टर साहब,
Hello.
यस यस
Yeah,
यस।
I think there was some problem with the connection.
राइट राइट राइट। यस, नाउ वी कैन हियर यू डॉक्टर, प्लीज गो अहेड।
Yeah. Acha, I was not audible because I was also not getting to hear anything that you were saying.
Okay, okay. So anyway, I'll repeat the
Ah,
question. Rahul
yeah.
again has one more question. Rahul ji has one more question कि उनका बीपी जो है डायलिसिस के दौरान अगर 150 से ज्यादा रहता है तो ही फील्स फाइन, लेकिन 140 से अगर कम होने लगता है तो फिर ही फील्स पसीने और अनईजीनेस एंड ही डजंट फील कंफर्टेबल अगर 140 से कम हो जाए तो।
फ्लक्चुएशन जो होते हैं 200 से अगर आप 140 तक लाते हैं, दैट ऑब्वियसली फिजियोलॉजिकली तो इट इज नॉट रियली वेरी मच एडवाइजेबल। आई वुड सजेस्ट दैट यू शुड नॉट टारगेट अ ब्लड प्रेशर, और मीनिंग आपका ब्लड प्रेशर 140 150 से ज्यादा जाना ही नहीं चाहिए। And basically blood pressure का meaning blood pressure बढ़ना is again a function of fluid overload. So there are other markers which indirectly we get to see, meaning we have an ultrasound wherein we can measure the IVC diameter. We have 2D echo which tells us whether the heart is also getting congested. Again, the heart function also starts dropping. So इतने ज़्यादा wide blood pressure fluctuations are not really very much advisable. So again, I come back to the same point that we should not probably put on more weight. And obviously, अगर blood pressure आपका 200 तक रहता है after you have achieved a targeted dry weight, then you may need to change or maybe probably re-alter your blood pressure medicines. The blood pressure in patients, most of our patients in who have CKD is related to fluid overload. So once you take care of your fluids well, either by restricting your fluids or maybe take an extra dialysis, even if you say that is what I advise my patients. We quite a few being on dialysis for 7 years. I would probably congratulate you. That's a very, I mean, I would say I wish you a long life on dialysis. And afterwards, what happens is whatever residual renal function, whatever the kidney function is, that is another concept. So, not everyone's kidney function has come down to zero. But gradually on dialysis, this residual renal function also starts dropping. So, मान लीजिए आपने जब डायलिसिस शुरू किया था 5 साल 6 साल पहले, तब आपका किडनी फंक्शन वुड हैव बीन से अराउंड 10%, तो वो ग्रेजुअली कम होते जाता है. तो उस हिसाब से आपका यूरिन आउटपुट भी कम होता है. सो उस टाइम पर मान लीजिए आप 2 लीटर पानी से टॉलरेट कर पाते होंगे, तो आज तो ऑब्वियसली 2 लीटर पानी आपके लिए ज्यादा ही होगा ना. तो बेसिकली ब्लड प्रेशर इज अगेन डायरेक्टली रिलेटेड टू द फ्लूइड ओवरलोड दैट यू आर हैविंग.
राइट राइट. नो थैंक यू डॉक्टर फॉर दैट. और एक क्वेश्चन है यहाँ जूम पे. आई एम ड्रिंकिंग 1.5 liters ऑफ वाटर एंड फूड. सो हाउ मच वाटर वी हैव टू बी रिमूव्ड द नेक्स्ट डे?
See, basically, with 1.5 liters of fluid intake that you are taking, if your weight gain does not go up, then you need not do any ultrafiltration. There are quite a few patients who, and if you're consuming only 1.5, I would probably congratulate you on doing that. So, your blood pressure, your dry weight, if that is all stable with whatever food and whatever liquid intake that you're taking, you can just take a plain dialysis or maybe a 500 ml ultrafiltration, which we give or which we probably target because there's some amount of saline which is going in when the dialysis technician or when he returns the. So if your weight gain is, it again would probably depend upon your weight gain. One more thing.
Right,
Yeah.
right. How much fluid, let's say somebody is above their dry weight, डॉक्टर, तो एक डायलिसिस सेशन में कितना फ्लूइड सेफली निकाल सकते हैं? ऐसा कोई है, कोई अपर लिमिट, या इससे ज्यादा तो होना ही नहीं चाहिए?
What we that's a difficult question to answer. Uh, but a good question. See, as I'm coming back to the same point, you are trying to remove whatever you want to in the given 5 or 5.5 liters of blood that you are having.
Right.
For a person who is hefty, it would probably be 6 liters. And more than 2.5 to 3 liters, the patients, it really becomes difficult. Because as I said, even if you are, say, put on 5 kgs and you target a 5 kg ultrafiltration, at the end of say 3.5 liters, you would start, and 3.5 liters, you have targeted 5 liters, but only 3 liters has come out. Your body will start reacting to it. Your blood pressure may start dropping because what is happening is you are contracting your blood volume. 6 लीटर में से आपने ऑलरेडी 3 लीटर निकाल दिया है. बाकी का जो बचा है वो आरबीसीज हैं, सेल्स हैं, डब्ल्यूबीसीज हैं, वो तो आप फिल्टर से नहीं निकाल पाएंगे ना. और जो पानी आपके टिश्यूज में है वो ब्लड में आने में टाइम लगेगा. वो दैट इज गोइंग टू हैपन इन द नेक्स्ट 4 5 6 आवर्स इवन आफ्टर योर डायलिसिस हैज स्टॉप. थोड़ा पानी शिफ्ट होता है, देयर इज सम अमाउंट ऑफ शिफ्ट फ्रॉम वन कंपार्टमेंट टू द अदर, बट इट इज नॉट, मशीन एक्ट्स मच फास्टर देन व्हाट योर शिफ्ट्स आर. टिश्यूज में जो पानी है, जितना हम 1 लीटर, मान लीजिए 1 लीटर पर आवर इज व्हाट द अल्ट्राफिल्ट्रेशन दैट इज टारगेटेड, सो इन 4 आवर्स वी आर टारगेटिंग 4 लीटर्स ऑफ अल्ट्राफिल्ट्रेशन। लेकिन मशीन ने 1 लीटर पानी निकाला, उतना पानी आपके ब्लड में आया नहीं है ना जो आपके टिश्यूज में है। So a rough gauge is most of our patients maybe tolerate around 2.5 to 3 liters. Beyond that, it is very difficult for any one of us to target that kind of ultrafiltration.
Got it. Got it. There is one more question from our Zoom participants. Doctor, my question is more water removal linked with better clearance?
Uh, to a certain extent, yes, but we have what is called as a convection and a conductive clearance. So not necessarily that. So I mean, there are quite a few patients who have that concept that अगर हमारा ultrafiltration नहीं हुआ है तो dialysis ही नहीं हुआ है. That is not the case. We have what is called as a solute clearance and a solvent clearance. Solvent means जिसमें ये जो waste products dissolve हुए हैं. So you can have a clearance of your potassium, of your phosphorus, of your acids, of your urea and creatinine, even if you don't set even 100 ml of ultrafiltration.
Got it. Got it. One more question, doctor, that comes to mind is that when we say the fluid removal, like what is included in the fluid? Is it only water? Or let's say if I have a cup of tea, is that also to be included? What about curd? What about ice cream? Like
Yeah,
the things that are included
that's
as
a very good question. That concept needs to be clarified. All things that can be measured are taken as fluid intake. Meaning, if you say, as you rightly said, if you are having 200 ml of tea twice daily, so that comes to around 400 ml. You are having a half bowl of or a half bowl of soup, which is about 100 ml. That again is 100 ml of fluid in it. So you have to add on whatever is measurable. All liquids, dahi, chas, buttermilk, lassi, thin dal, soups, and tea, coffee, of course. All that would probably be included in the total amount of fluids that you're going to consume over 24 hours.
Okay, okay. That's very helpful, doctor. There's one more question here that says, is there any way to make water move faster from tissues to the blood compartment on dialysis and off dialysis? Like
Good
आपने कहा
question.
कि
No, no.
is there a way
Good
to
question.
make it
That
move
if there is
faster?
some measure that जो 6 लीटर पानी इकट्ठा हुआ है वो 4 घंटे में हमने मशीन से निकाला और वो 4 घंटे में ही आपका टिश्यूज में का पूरा 6 लीटर पानी, नो नो, अनफॉर्चुनेटली नॉट. We the body does not permit that. The shifts that happen are according to whatever the physiological makeup of the body is. So there's no way that, or there's no machine, or there's no setting on the dialysis machine that would increase the shift of fluid from one compartment to other.
Got it. Got it. There are many questions coming. This comment I'm addressing to all of you who are watching this webinar. There are several comments I'm seeing which are not related to the topic of this webinar. I request you to please restrict your questions. जो आज हम डिस्कस कर रहे हैं फ्लूइड ओवरलोड के बारे में, प्लीज सिर्फ इस मुद्दे को लेकर आपको कोई भी प्रश्न है तो वो पूछ सकते हैं. जनरल अभी आई कैन अंडरस्टैंड कि बहुत सारे क्वेश्चंस होते हैं हम सबको, पेशेंट्स को, इस डायलिसिस को लेकर, लेकिन वी विल हैव मोर एंड मोर वेबिनार्स एवरी मंथ ऑन वेरियस टॉपिक्स, और दूसरे टॉपिक्स पर प्लीज लेट अस नो व्हाट यू वुड लाइक अस टू एड्रेस एंड वी विल डेफिनेटली हैव सेशंस ऑन दोज टॉपिक्स. बट in this particular this particular webinar, please restrict your questions only to fluid overload. So there are one more question, Dr. Saab. What are the special considerations to be kept in mind for someone who has undergone bypass? And I'm assuming this is in the context of fluid overload. So anything that anybody who's undergone a bypass needs
Yeah,
to be
that is
more
a good
careful?
question. Yeah, that is a good question. Here you are dealing with two major organs which are not probably functioning adequately. So for a person who has either gone some kind of a cardiac intervention, may it be either a PTC, a stent, or a bypass, depending upon what the heart function is, that particular individual may or may not tolerate excessive ultrafiltration, because the heart is also geoperiodized and it may not take the stress. See, basically, when you are removing fluid from the body, the heart is being stressed out. And if your heart is stressed out, so that's the reason why some of our patients who are not very stable on hemo, they do better on CAPD.
Right, right. Got it. Why does BP drop during dialysis even without taking out too much fluid?
Then in that case, I would probably say that the dry weight of that individual is probably gone up. And that in fact is a good sign. That in fact means that your center or you're taking an adequate dialysis. So all of us in the initial stages of CKD, because of all the uremic toxins, they have their own anorexia, they have nausea, vomiting. And most of our patients, when they land up with dialysis, are in a catabolic state or in a negative balance state. They have lost their muscle mass, they have lost they have reduced their weight, unless of course they are grossly fluid overloaded. What I'm trying to say is they have lost their muscle mass or they have lost weight. And in case your PP is dropping despite the ultrafiltration that is targeted is not removed, means it is a good sign. Then in that case you need to reset your dry weight, meaning you probably are eating better with dialysis, your uremic toxins are getting better, your hemoglobin is getting better, you have started doing exercise, and all that means it is a positive state of health which is coming back after the dialysis which was initiated. Sorry. So in that case, you probably should probably reset your dry weight to a higher level, maybe half a kg or 1 kg every session, depending upon how well you are tolerating the ultrafiltration. And it's not going to be a one-time affair. It is spaced out over the subsequent few weeks after the dialysis has been started.
Got
And
it.
as I said, most of our patients should put on weight after the initiation of dialysis,
Right, right. Yes.
the dry weight, I mean.
Correct, correct. Right, Doctor. One question that I had is अभी आपने जो अभी cover किया that talks about the immediate complications अभी for example cramps or low blood pressure etc. Are there any long-term complications for continuous high fluid overload that we need to be worried about or we need to
No,
expect?
so the fluid starts accumulating everywhere. I mean, it causes dysfunctioning of the heart. It accumulates along your in the pericardial fluid, in the pericardial space. So that compromises the heart function. It gets accumulated in the lungs, in the pleural spaces. So that adds to the breathlessness. So the fluid is not restricted. It gets accumulated in each and every wherever it finds space. It goes and occupies that.
Right, right, right.
So
That's
these are
very
the long-term complications. If some quite a few of our patients do develop what we call it as ascites, meaning the abdominal cavity starts getting filled up with fluid. So some of them unfortunately need ascitic tapping also because, as I said, that ascitic fluid is in the third space. It will
correct.
probably, with whatever adequate dialysis or whatever adequate ultrafiltration that you target, that ascitic fluid is not going to come into the blood volume, and after the tapping they need to probably restrict and restrict their fluid intake.
Right, right. Uh, One question is there. I have put on 10 kgs dry weight. Can this weight come down?
I mean, that again, if it is obesity, then you would probably need to probably work on your diet, work on your exercise schedule. But if that was the weight that you had lost before you initiated dialysis, and if your muscle mass has improved, if your exercise tolerance has got better, if your exercise capacity is getting better, then I don't think. But 10 kgs, I doubt whether someone would put on as a dry weight. So unless that, so you need to look, I mean, it is like an obesity which any one of us would probably address too.
Got it. There's one more question here, Dr. Saab, that doing dialysis from 1.5 years, twice a week, between dialysis, my weight gain is around 3.5 to 4 liters. I do not face any issues during dialysis apart from occasional leg cramps. So anything you would like to advise him about? in this particular situation?
Despite putting on 3 to 4 kgs into dialysis, uh,
He's not
uh,
having too many symptoms, once in a way, leg cramps. So is it okay to have 3.5 to 4 liter?
so then in that case, as I said, his dry weight, if he's getting cramps, means he's probably getting adequately, ultrafiltration is being done adequately. But I would suggest 2 times a week dialysis will still, in the long run, not be adequate.
Right,
Your
right,
dialysis prescription would obviously depend upon other parameters than just your weight. So, depending upon that, I would probably suggest you talk to your nephrologist and see if the dialysis requirement is going to be initially, no one of us would probably have the ill effects of under dialysis, but over a period of time, the heart starts becoming weak. You start getting a dysfunctioning of the heart. Your anemia gets worse. So all these things, it is not just the fluid overload or the fluid that we are looking at when we are talking about adequacy of dialysis.
right. One question that is there on Zoom is one patient, 3 to 4 chapatis he eats in a day. That chapati, what roughly can do they need to budget for ml of fluid? Like, is there some kind of a? I think we know that rice has a lot of water, right? But chapatis also, do we need to count that much like
Chapati,
that?
I, I should have been a better cook than what I am probably. I suppose if you can quantify the measurable amounts of fluids, I think that's fine now. Because meaning if you
Got it.
account for the liquids that are measured, the
Right.
amount of liquids that you're consuming, the ones which can be measured, I doubt whether anyone would probably recommend the amount of fluid. Obviously, for the जो आप डो बनाते हैं उसमें भी पानी जाता ही है. So theoretically, we should be accounting for that. But then I think if you can probably, that is fairly good enough as a rule of thumb. If you can
Right.
measure the amount of measurable fluids that you're consuming.
Got it. I hope that question is answered. Why is body weight? Sorry, before that, there is a question that says, what should I do in case of acute symptoms of fluid overload before I need to access medical care? So let's say somebody has indulged a little and there is, some symptoms
Someone
of
has
fluid
partied
overload.
outside somewhere.
Yeah, yeah. So at what point
No,
do they
the
need to
first and foremost is one thing is you should not land up in a situation like this because if and if you are diuretic sensitive in the sense that if you are passing at least some amount of urine before you reach your center, maybe try out with whatever diuretic that you are taking, furosemide or whatever dietol, torsemide, furosemide. If that works, well and good. But as I said, if the output, quite a few of our patients are almost anuric. What I mean by anuric is they are not passing even a drop of urine. So there are no drugs which will probably get you out of this fluid overload, and it is only dialysis which would probably take care of that. If you are having breathlessness and all, nebulization and all might help in just slightly opening your airways, but the fluid will not come out unless you have some amount of residual kidney function in the form of volume of urine that you are passing. So by the time that you reach the dialysis center, you can try with diuretics. Depending upon whether they work or not is a different story altogether.
Right. And I think if they're feeling very uncomfortable, then they should not hesitate to reach
No,
out to.
not wait at home. Reach
Yeah.
the emergency as fast and as
Right.
early as
Right.
as you can.
Right. Right. There is one question on body weight. I think the body weight is increasing despite the individual's mother is the patient and she's following proper instructions, but despite that, body weight is increasing. What could be the reason? I think is the question.
Good question. Uh, what happens is the dry weight that we have set, body weight is increasing. Or meaning they are not achieving the dry weight. What happens is with age, all of us tend to lose muscle. So the dry weight when his mother started off dialysis would probably have gone down, and the amount of fluid that is accumulating is not getting removed because you are going by the previous dry weight that you had set. Suppose now she started off with a dialysis or with a dry weight of around 50, and every dialysis she puts on 2 kgs. So when she reaches the center, she is 52, and they target 2 liters of ultrafiltration. But she's been on dialysis, say, for whatever 2-3 years. And with age, with whatever uremic symptoms, with her appetite not being as good or her exercise, her dry weight from 50 has come down to 48. And she reaches the center with a pre-dialysis weight of 52. So she has that concept that my dry weight is 50 and the targeted ultrafiltration should be 2 liters, which means that she every session she is probably remaining 2 liters of positive. So in that case, we again need to down titrate. As I said, we up titrate and we down titrate the dry weight depending upon the individual's need and individual's overall other the comfort level or whatever, meaning the overall health status of that individual.
Right, right. The gentleman who mentioned that he has put on 10 kgs, he's asking that he has put on this over the last few months, and it has been adjusted, after looking at the BP readings and so on. But his question is that, does high flux single use core Diax 100 dialyzer have a part in this weight gain? Could it have a part?
Sorry.
So
So that means he's getting a better quality dialysis.
yeah, so could
High
that
flux
result?
dialysis definition meaning all said and done, he's getting a better quality dialysis.
Correct. So could that actually result in the weight gain, is his question.
Yeah, it would indirectly, it would probably come, it would bring back to what your original status was.
Got it. Got it. There is one question on non-veg diet. So in terms of this whole fluid control and so on, is there any difference between veg and non-veg, or are non-vegetarians less likely or more likely to put on more fluid or anything like that with related to the diet, doctor?
That again would depend upon how much of salt you're consuming along. Most of these non-vegetarian preparations are probably very high in salt content. And indirectly, if you are consuming more salt, I mean, we normally permit about 2 to 5 grams of salt per day for an individual. But if you are non-vegetarian, I am a strict vegetarian, but then correct me if I'm wrong. Most of these fried items, even the fish or the non-vegetarians, they would probably be more in salt content than our vegetarian preparations would be. So that might increase, not the meal itself, but then the amount of salt and the water.
Got it. Got it. Right. Yeah. So I think we've covered all the questions. If anybody has any questions, they can quickly type it in the chat or put it in the comment on Facebook. In the next couple of minutes, we'll wind up. But Dr. I think that was very, very useful. But parting words, takeaway message for all of us who are watching this and participating in the webinar on this topic, fluid overload and how to manage.
Yeah. So as I said, and I would probably repeat that you would probably tolerate a dialysis better if the amount of ultrafiltration that is targeted is not supraphysiological. Meaning, as I said, 1 to 1.5 liters of fluid removal, the body tolerates well. Uh, After that, it becomes difficult. There would be quite a few patients who would say that he's been taking dialysis and every dialysis session 3 liters. But then that is what my take home message is. You need to understand the concept of dry weight. You need to understand the shift of the fluids and uh, all said and done, your well-being, the amount of activity that you are doing, and what kind of a lifestyle that you were having, you are able to cope up with that means you are doing good on dialysis.
Right, right. Couple of questions have come in. I think this is such an important topic that a lot of people have questions. If you permit me, Doctor, another 2, 3 questions we can
Yeah,
take.
sure, sure.
When would I know I have reached my correct dry weight, and will it come down in the future?
In fact, dry weight should not come down in future because all of us don't lose weight. Now, see, I am constant at 70 kgs for God only knows so many years. So if it comes down means you are losing muscle mass, your nutrition is probably getting hampered, or your exercise is not proper. What was the first part of the question?
How would I know? I think the question is, how would he know that he has reached his
So
dry weight, his correct dry weight?
what is your targeted dry weight is what he's trying to see. The at the end of the session, you should not be getting cramps. Your blood pressure should not be dropping drastically. Is what your dry weight is. And at the beginning of the dialysis session, there should not be any peripheral edema. You should be able to walk with no amount of breathlessness, meaning that is a state where you are not neither fluid overloaded nor volume depleted. So your blood pressure and your cramps decide whether your hydration is adequate or not, and your swelling of the feet, your tummy bulging out, you're getting breathless even on or getting breathless on on accustomed exertion means your fluid accumulation is there. So you need to strike a balance between these two. On one end, you have excessive removal, which gets reflected in the form of cramps and blood pressure dropping. And on the other hand, if your fluid removal is not proper, or if you are not achieved your dry weight, you are volume overloaded, fluid, meaning edematous, breathless.
Got
So
it.
the balance is in between these two.
Right. There's a question about blood pressure. Why is the blood pressure always high for my mother? Is there something that we can offer there, doctor?
That again would probably depend upon how much of an ultrafiltration, and many a times we try to control the blood pressure by adjusting or lowering the dry weight, meaning she is probably still fluid overloaded despite the fact of whatever ultrafiltration that is being done during dialysis.
Got it.
So try to readjust the or try to remove some excess fluid on every session as much as what she can tolerate.
Got it. Uh, there's a question that says, अगर dry weight say 64 kgs हो और 68 kgs weight हो, 64 लाते लाते 4 लीटर कई बार प्रॉब्लम होता है, मगर अगर से 65 पर रुके और अगली बार से 67 हो तब 64 प्रॉब्लम नहीं होता, ऐसा क्यों? I think he's talking about the ultrafiltration rate.
Rate, yeah.
Yeah,
So
if you
that
could
is
just,
what I said ना. See,
yeah,
आपके 6 लीटर में से 4 लीटर पानी निकालने की आप कोशिश कर रहे हैं, वो संभव नहीं होता है बार बार, हमेशा होगा ही ऐसे नहीं. सो वो 4 लीटर में का 1 लीटर पानी शरीर में रह गया, वो आपने अगले बार एडजस्ट करके निकाल दिया, तो दैट इज ऑल्सो फेयर इनफ.
correct, right. Great. I think that was a very informative session, Dr. Ambike. Thank you so much for the time that you spent
Yeah,
answering
thank you
our
so much.
questions and explaining the
My
concept.
pleasure. My pleasure
Really
for having
appreciate it.
been invited.
Yeah.
And thank you so much, Kamal and the NephroPlus team.
Thank you. Thank you so much to the viewers. Thank you so much for joining us today on a Sunday morning. और ऐसे ही टॉपिक्स पर, अलग अलग टॉपिक्स पर हम हर महीने आपके साथ जुड़ेंगे. And I hope all of you will continue to join and take advantage of these webinars. Thank you so much on behalf of the entire NephroPlus team. Thank you. Thank you, Doctor.